inside the mind of the depressed. The three neurotransmitters that are involved in the feeling of depression are serotonin, dopamine, and norepinephrine. I'm not sure if I'm saying that right. But when levels of these chemicals in the brain are low, it results in feelings of depression. It is important to maintain balance between these neurotransmitters because without them, an individual may begin to retract from relationships, socially isolate themselves, lose interest in activity, beat themselves down, etc. Depression goes far beyond just being sad. If chemical imbalances continue to go untreated, that specific individual may be emotionally, mentally, and socially detached. Antidepressants are highly recommended to individuals suffering from depression. Antidepressants can be described as a prescribed medication that helps increase the levels of serotonin in the brain. Just as when levels of serotonin are low, we feel symptoms of sadness, when levels of serotonin are high, we feel happy. However, there are tons of side effects that follow alongside antidepressants. Symptoms such as fatigue, nausea, increased or decreased appetite, insomnia, blurred vision, constipation, and these are only a few side effects. Due to these serious side effects, in order for an individual to be prescribed with these types of medications, they must be evaluated, clinically diagnosed, and reevaluated all by a professional. Individuals that do pass the required evaluations are required to be closely watched to make sure antidepressants are not drastically impacting them. Antidepressants can help balance out imbalances in the brain, which is a good thing, but they can also do more harm than good in some cases. Most professionals also recommend for an individual prescribed a medication to also be involved in some sort of therapy. Professionals recommend that individuals prescribed to some sort of antidepressant medication also are involved in some sort of therapy. Studies have shown that group therapy is the best type of therapy for an individual suffering from depression. Group therapy can be described as a type of therapy where depressed individuals come together to discuss their shared concerns, feelings, emotions, etc. with one another. Now, in this scenario, the only reason that I'm saying that depressed individuals come together is because I'm talking about depression. Usually, group therapy is where like a bunch of individuals experiencing the same symptoms and phenomenons all come together, but in this case it'd be depression. This type of therapy allows individuals to understand that they are not alone in their feelings and that there are people out there that are willing to help them. It also allows an individual to develop self-awareness by listening to others with similar issues. I also believe that group therapy is the best form of therapy because it allows individuals to express themselves in front of others without the fear of judgment. It helps them normalize their experiences, it helps them learn new coping mechanisms, thought processes, etc. Individuals that are diagnosed depressed often feel alone and have trouble opening up, causing them to have a hard time creating relationships. This group therapy can allow an individual to see that they are not the only ones going through something, and it allows them to make friends without feeling pressured or out of place. Depression is one of the most common mental illnesses in the world. One of the primary reasons depression is so predominant in younger teens or younger adults is because younger adults undergo more stress than an average adult or an average person. I believe that young adults are also given an expectation that society has set, and when they fall short, they are not considered as high class, as fancy, or respectful. This also brings additional stresses and puts pressure upon that individual. Statistics has also shown that social media plays a large role in reasons why young adults are more likely to suffer from depression. Today, social media puts off that the only way you will be rich and famous is if you were born into money and you have an attractive physical appearance. It's hard as a young adult, especially women, when all we see is young, attractive women and men in their bathing suits on a beach in Costa Rica. It sets unrealistic expectations, and over time, that can cause an individual to have problems with self-esteem and confidence. The suicide rate due to depression among younger adults is also much higher than the average. Depression in young adults is more likely to have long-term changes in personality, mood, behavior, etc. They will act solely out of emotions, such as expressing emotion in fits of anger, sadness, misery, etc. Mistakenly, depression has been linked to aging, which is completely false. Aging and depression have absolutely no correlation whatsoever. As a matter of fact, studies show that older adults feel satisfied with their lives and get happier as they age. Depression in older adults is caused by life changes such as the diagnosis of a chronic disease, death of a loved one, mental, cognitive decline, etc. For most adults, their symptoms are not the same as for younger adults. Their symptoms will look like symptoms more so of laziness, such as irritability, loss of energy and motivation, fatigue, difficulty remembering things, etc. 9 in 10 older adults battling depression, will not be willing to discuss their feelings and will have trouble sleeping at night, which will lead to the feeling of agitation. Depression in older adults often comes with other medical illnesses and disabilities, and they will also be more likely affected by their depression for a longer period of time than younger adults. It is also associated with an increased risk of cardiac disease. Depression increases the risk of suicide, and the suicide rate for people ages 80 to 84 is 2 times more than the average population. Any adult over the age of 65 suffering from depression is considered to be a major public health problem. Physical conditions of the elderly, such as strokes, hypertension, diabetes, cancer, etc., can further increase the risk of depression.